DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hi there folks, Dr. Dan from DocTalk. Thanks for joining us today. We're going to have a great show. We're going to talk about antibiotic resistance, surveillance of antibiotic resistance, and many things to do with judicious use of our antimicrobials. Our guest today is Dr. Brian Lubbers from the Veterinary Diagnostic Lab here at Kansas State University's College of Veterinary Medicine. Stay tuned.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Brian, welcome to the show.
Hi, Dan. How are you?
Good. Folks, this is Dr. Brian Lubbers, and he is a clinical pharmacologist, and he's an assistant professor here at the Veterinary Diagnostic Laboratory at Kansas State University, where he is working with different things that have to do with bacteria and antibiotics, bugs and drugs, right?
Bugs and drugs. That's right.
Great. Well, I think one of the first things we need to talk about and just share with us, you do a lot of work with antibiotic resistance.
Yep.
And I think that right now there probably couldn't be a hotter topic.
Nope, probably not.
in animal agriculture than antibiotic use, antibiotic resistance, and things to that nature. So let's just jump off and kind of start talking a little bit about antibiotic resistance in general terms.
Sure. And when we talk about antibiotic resistance, whether we're talking about animal health or human health, the concepts are all the same. When a bacteria becomes resistant to antibiotics, something about that bacteria has changed. And antibiotics work, they're chemicals, and so they fit into specific places, and they either slow the growth of a bacteria or they stop that bacteria from reproducing, and that's how antibiotics work. When a bacteria becomes resistant to that antibiotic, something has changed, and that chemical fit doesn't work anymore, and so basically the bacteria doesn't respond the same way that it used to.
Gotcha. So you know, I'm sure there's different ways of acquiring antibiotic resistance and different populations of bacteria out there that are just naturally resistant to different drugs. But what are some of our more common issues, or would you say some of our more common problems with food animal antibiotic resistance or foodborne pathogens?
Sure. And they're kind of two issues, and I think we'll probably get into programs later, surveillance programs later, but you know, we talk about foodborne pathogens and resistance. Really probably the two biggest bacteria of concern would be Campylobacter and Salmonella. Those are the ones where if those bacteria become resistant, we see them go through the food chain, and it's still rare, but they can cause problems in humans. And the drugs for those that we would be worried about would be the third generation cephalosporins, and our sister drug in animal health would be Xanel or Exceed.
Right.
And then the fluoroquinolones, and our sister drugs there would be Baytril or Danofloxacin, Advocin now. Yep.
So I think that I think it's important for people to understand that we have these drugs labeled for specific cattle, specific animals. It's not just cattle. And the impact that we have not only on the target pathogens that we're treating for, we can also have some impact on foodborne pathogens, and that's why it's really important to work with the veterinarian.
Yeah, and you'd asked on the animal health side, what we're seeing here at Kansas State are some concerning trends with bacteria that cause bovine respiratory disease. So Mannheimia hemolytica, Pasteurella multocida, Histophilus somni. We're starting to see some increases in resistance, and with Mannheimia specifically, not just to one drug, but many drugs at the same time. So one Mannheimia hemolytica from one animal case can be resistant to 6 different classes of antibiotics.
Cool. Well, folks, we're going to take a break. It's going to be a great show. We're glad Dr. Brian Lubbers is here. More after these messages.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment.
Julia Herman took a winding path to become a veterinarian, with inspiration as a child from National Geographic books, then with a bachelor's in zoology and a master's in epidemiology. After graduation from Colorado State's College of Veterinary Medicine, Julia plans on finding a position that combines livestock and wildlife medicine, epidemiology, research, and public health.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Calves require adequate, high-quality colostrum immediately following birth to receive the immune and nutritional support needed to fight diseases and thrive. Next-generation Colostrix colostrum replacer and supplement are USDA licensed to aid in the treatment of failure of passive transfer and contain natural maternal bovine colostrum antibodies against E. coli K99. Ask your animal health supplier for Colostrix or visit agrilabs.com for details. Colostrix makes all systems go.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson and Dr. Brian Lubbers. We're from the College of Veterinary Medicine at Kansas State University, where Dr. Lubbers is a clinical pharmacologist. You're over our bacteriology section.
That's
at
great.
The Veterinary Diagnostic Lab. So Dr. Lubbers has seen a lot of cases from all across the country when it comes to antibiotic resistance and bacteria and antibiotic susceptibility in bacteria to help veterinarians and producers get the right drug for the right bug or the wrong bug as we're moving forward with our caseload. And as we left, we were talking about multidrug resistance. And let's talk a little bit about some of that and what you're doing.
Sure. So really in the diagnostic lab, our primary function is to help veterinarians and their clients, like you said, choose the right drug for that specific bacteria that they have going on in their herd or that situation. And we do that through a series of lab tests. We can test that bacteria against a panel of antibiotics and then help veterinarians choose the right one. And you had mentioned judicious use, and that's a big part of judicious use of antimicrobials is we want to make if we have an antibiotic that isn't working, it's not going to help, can promote resistance in those other pathogens, the ones we're not trying to get, like the E. coli's, the salmonellas, the campylobacter, but help them pick the ones for that BRD pathogen that's really going to give them the best shot of working. So that's our primary job. But the other thing that we do really on a kind of daily to yearly basis is we take all the results from those individual tests and then we pool them together and we summarize them so that people have an idea. Even though I may not have a case right now, I want to know over the last year, what are the drugs that have generally been working against, say the BRD pathogens? what are the things that aren't working, and we take all those individual results and we pool them so that everybody kind of gets the benefit. And that's our version of surveillance, Dan. We take that, and once we've been doing that. We've actually just finished a 11-year summary of BRD pathogens, and what it kind of does initially, it gives us a baseline. So we know, in year 1, our levels of resistance are 10%. And what we feel like that does is if we do it every year, it gives us kind of a real-time feel for, are we seeing big changes? And we are, like I said,
Yeah.
we're seeing those. So, the 2 steps to surveillance: establish a baseline, and then after that, use that baseline to help you detect kind of an early warning,
And I think that's one of the reasons why it's important that producers and veterinarians submit cases to the diagnostic laboratory, so that we have a good library and a good snapshot of what's really going on. My dad used to tell me it was easier to sell a vaccine for a few $1,000s than it was to sell a diagnosis for a few dollars.
Right. Yep.
And so, sometimes we say, well, I'm just going to start using this vaccine or switch to this drug, without doing diligence and getting that diagnosis and using the expertise that you have to help us be more zeroed in and more laser focused.
Yeah. And the more samples we get that represent a broad base, the more applicable those results are to everybody at the end of the day.
Absolutely. I think that when we take a look at diagnose, how many cases do you see on these?
Cases, the last few years of our surveillance, we're getting about 300 Mannheimia hemolytic isolates a year. So that doesn't represent all the cases. It's a smaller percentage, but yeah, we see several hundred to 1,000 BRD cases a year.
It's absolutely amazing. Well, folks, we're going to take a break. When we do, we're going to come back more with Dr. Brian Lubbers. You're watching DocTalk, and we're sure glad you joined us.
The BQA Tip of the Day, sponsored by Boehringer Ingelheim Vetmedica, Inc.
Hello folks, this is Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation out of Great Bend, Kansas. Today's BQA Tip of the Day, we're going to visit about sanitation in any sort of processing facility. It's extremely important that we keep our processing facilities very clean, free of any debris and any harm. We want to clean these off every day or after each use. If we don't, we just get buildup of manure, byproducts. We get buildup of especially problematic things like viruses and bacteria. We want to clean it, use some Clorox, dilute Clorox 1 to 10, sanitize these things every day or after each usage so that we prevent spread of disease. Even in particular, such as this little tidbit, this facility, they keep their thermometer there, they keep it in some dilute, keep it sanitized, keep it clean. We want to keep these facilities, again, spick and span. It's very important to our biosecurity success, whether again it's a cow-calf facility, stocker, starter yard, or feed yard. If we don't keep it clean, our animal health outcome will not be what we want it to be. Thank you.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Join the team, the Beef Quality Assurance Team. Getting BQA certified shows you're committed to practices that produce the highest quality beef in the world. And by visiting BQA.org, you can take the online certification course at a time that fits your schedule and from the comfort of your home or office. You'll also find lots of helpful tips on improving animal health and animal handling practices. Get certified, BQA certified, because it's about doing the right thing. Visit BQA.org today and become a member of the BQA team.
TrueTest Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Brian Lubbers, where we work at Kansas State University's College of Veterinary Medicine, and Dr. Lubbers is over the top of our bacteriology section at the Veterinary Diagnostic Lab. And he also works a lot with antibiotic resistance because he's a clinical pharmacologist, which in academia, there aren't very many of them.
53.
53 total in the United States. So, and, you know, we're very glad you take time to be on the show. Very thankful for what you're doing for our state and for our industries. Let's jump into some foodborne pathogen surveillance. And the reason why we want to is because there's some pretty good news that could be told.
Sure. And really when you talk about those programs, really the one we've had in the United States for a long time is called NARMS, the National Antimicrobial Resistance Monitoring System. And that program's job, it really is focused on public health. So their primary interest is monitoring bacteria and resistance that's of concern in humans. Right? That's their goal. And part of that is monitoring resistance in foodborne pathogens. You know, we had mentioned E. coli earlier, Salmonella earlier, Campylobacter earlier. All of those bacteria are part of that NARMS program. And so every year they collect samples. They collect samples that come from sick people. They collect samples from meat products, and then they collect samples at the animal level too. Not usually from individuals, but from pen fecal samples, for example.
Right. And
they take that data and they look at what are the percentage of those isolates collected at each of those points that are resistant to their antibiotic panel. And again, that antibiotic panel is generally focused on the antibiotics that they use in human medicine, but there's significant overlap. A lot of the drugs the antibiotics we use in veterinary medicine, they may not be the exact same, but they're certainly sister drugs to those drugs. So, the idea is that if we're using those drugs in animal health, how does that contribute to the overall resistance problem in humans?
And when we start to think about resistance from antibiotic use in animals going to humans, the foodborne pathogen is probably the highest priority as far as that transmission.
Yeah, it's pretty complex, and there's a lot of research going right now about how does resistance transfer through the environmental route. So manure is collected on farm that's been exposed to antibiotics. If that gets into the water, is spread onto a field, how does that get into the food chain? But certainly the most direct, it'd be through the meat products themselves.
And we've had some pretty good news.
Yeah, everybody can access the NARMS report actually, and if you go on there, for the most part, a lot of our drug resistance, and specifically in meat products and the antibiotics that we use in animal health, it's stable or going down. Now there are some bacteria that we've got some concerning trends that we need to watch, but it's a lot of part of it good news.
Great. Well, we're going to take a break. Folks, if you're watching the show, thanks for joining us. Also, for you out there, the producers of beef producers and veterinarians, thanks for the job that you're doing for having us have a safe and wholesome beef supply every day. We're going to take a break. More after these messages.
Working your cattle just got easier. Introducing the new VetGun delivery system. a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
This hog is Hanover hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help? How can we help?
Beef producers asked for it, and the wait is over. Enroflox 100 Enrofloxacin from Norbrook, now approved for single-dose treatment and control of bovine respiratory disease. With the same active ingredient and dosing regimen as Baytril 100 in beef and non-lactating dairy cattle. Choose Enroflox 100 when looking for an injectable antimicrobial solution to treat and control BRD. Observe label directions and withdrawal times. See product labeling for full product information, including warnings and precautions. Consult your veterinarian to see if Enroflox 100 is right for your cattle.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to DocTalk. Dr. Dan Thomson and Dr. Brian Lubbers. We're having a great show today. Hope that you're enjoying it. We're talking about antibiotic resistance and the good news that we've seen from decreased antibiotic resistance in our foodborne pathogens thanks to judicious drug use, veterinarians, producers working together on a day-to-day basis to continually kind of rein in drug use to what's appropriate. But you have a program going on over in Olathe, at our Olathe campus, that's pretty exciting as well.
Sure. And what we did, again, we're seeing some concerning trends of increasing resistance in the bovine respiratory disease pathogens here. Now, those samples are all taken from animals that were affected with respiratory disease, probably have been treated with antibiotics, maybe died of respiratory disease. So one of our questions was, is that representative of what's happening with the healthy animals, the healthy population? And so working with Merck Animal Health, we actually started a new lab section that is specifically designed to monitor bacterial antibiotic resistance in the healthy population of U.S. cattle.
Wow. So how far along, how long have you been doing this? How do we get samples to you? Things to that nature.
We've had this program going for about 1.5 years now. It's a little bit early to make any definitive conclusions. So, but as far as getting samples to us, again, all of this is going through Merck Animal Health Technical Services. So if you're a veterinarian, contact your Merck Animal Health Technical Service. They are running they're running a lot of the logistics. So we don't want too many samples from one place, but we're trying to represent cow-calf, feedlot, and dairy from all across the United States. We want a nice representative sample.
So then you get the samples, the respiratory disease samples, different size of cattle, different production systems, different geographical locations, and then you can start to zero in on antibiotic resistance within those different populations and geographical locations.
Yep, that's absolutely right.
That's a tremendous tool. And then will that be coming out in a publication? Will Merck be sharing that then, bringing it forward?
Yep.
How are people going to get access to that?
That's our eventual goal, is to make that public, to make publication out of it, really, is what we're trying to do. The goal, again, with 2 points of surveillance, establish baseline, And then the continuous monitoring allows us to detect early warning signals. Right now, we're certainly in the baseline level of this program, so we want to know, what does resistance look like out there. After that, we hope the program will continue, and then if we see disturbing trends, increases, we'll be able to pick that up earlier and then go back and kind of trace back, what are the risk factors or what are the events that contribute to those.
Cool. Well, thanks for being on the show today.
You're welcome. Thank you.
And thanks for what you're doing.
Thanks.
It's a big job. Dr. Brian Lubbers here at the Veterinary Diagnostic Laboratory, Kansas State University, that he's doing for our industry, he's doing for One Health, and we commend him for his service. Thank you for watching DocTalk, and remember, always work with your local veterinarian. And if you want to know what Dr. Lubbers and I do here at Kansas State, you can find us on the web at www.vet.ksu.edu. I'm Dr. Dan Thomson. You've been watching DocTalk. We appreciate it, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.